Chuck, OSF's innovation arm gets a cash infusion, thousands of dollars to expand their outreach for opioid prevention.
Those projects intended to offer resources and education in less populated sections. Here now is Liz Leap.
OSF Innovation in Peoria has received thousands of dollars in grant money to help reduce opioid substance abuse and overdoses across the state. And they're focusing on smaller, outlying towns and villages. Expected to take off in September, OSF is setting up their first rural community outreach tour in Henderson County, near the Quad Cities. They received a $75,000 grant from a group called the Connected Communities Initiative to provide community outreach, resources, education, and conduct research in areas that need these resources.
Rural areas have very, what can be overwhelming challenges in healthcare because of the distance.
He says the data collected could help establish better resources and education here.
It will help to contrast, some of the data we're collecting in urban areas, and what are those attitudes?
In collaboration with ISU, a $30,000 grant from the Illinois Innovation Network is also being used to develop augmented reality tools to teach people what to do in the event of an overdose, such as practicing administering naloxone or Narcan.
When you're in a hectic situation, you don't know how you're going to react, or it will give some experience with that.
Peoria's Jolt Harm Reduction Executive Director Chris Schaffner says local rural areas see more stimulant use than depressants. However, many times people don't know that there are depressants like opioids combined with the stimulants they are using. Schaffner believes education will be key in OSF's initiatives to combat the opioid epidemic in these smaller communities.
They may not have access to the same type of health literacy and healthcare literacy and medical education that others might have. And so the best thing we can do, and we found this to be true in urban, suburban, and rural areas, is to deliver the services to folks.